Health officials across several countries are racing to track dozens of passengers who left a cruise ship linked to a deadly hantavirus outbreak before authorities realized the seriousness of the situation. The outbreak aboard the expedition cruise ship MV Hondius has already resulted in multiple deaths and several confirmed infections, sparking international concern and comparisons to the early days of cruise-related COVID-19 incidents. Investigators say more than 24 passengers from at least 12 countries disembarked from the vessel during a stop on the remote island of St. Helena before the outbreak was officially identified. Health agencies in Europe, Africa, North America, and Asia are now working to trace those travelers and anyone they may have come into contact with since leaving the ship. Authorities say the operation has become increasingly urgent after the first confirmed fatality connected to the outbreak was reported on board in April. The ship had departed from Ushuaia, Argentina, in early April on a lengthy expedition voyage through the South Atlantic. Investigators believe the outbreak may have originated before boarding, possibly during a bird-watching excursion taken by a Dutch couple in South America. The couple later became among the first passengers to fall seriously ill. Medical experts suspect the outbreak involves the Andes strain of hantavirus, a rare version of the disease capable of limited person-to-person transmission. Most hantaviruses spread through exposure to infected rodent droppings, urine, or saliva, but the Andes strain is considered unusual because it can sometimes spread between humans during close contact. As concern grew, several infected passengers were evacuated from the ship to hospitals in South Africa, the Netherlands, Germany, and Switzerland. One British passenger reportedly remains in serious condition while undergoing treatment in isolation. The World Health Organization has emphasized that the overall public risk remains low and that the outbreak is not believed to pose pandemic-level danger. Still, officials are continuing contact tracing efforts out of caution because of the international travel involved and the unusual transmission pattern linked to the Andes virus. Passengers still aboard the MV Hondius have reportedly been confined to cabins while additional medical teams investigate the outbreak. The vessel is expected to continue towards Spain's Canary Islands, where further health screenings and evacuations may take place.